Hello, and welcome to the Lake Health Diabetes Education Program. My name is Marjorie Lang, and I'm the Diabetes Education Manager of the Diabetes Education Services Program here at Lake Health. The program focuses on diabetes management for those with the condition of prediabetes, type 1, type 2, as well as gestational diabetes. Today we present to you this video which discusses some of the important topics in diabetes self-management. Our team of talented diabetes educators and certified health coaches are comprised of registered nurses and registered dietitians who can help you with lifestyle change to improve outcomes related to your condition of diabetes. Contact our department today to schedule a diabetes class or an individual assessment. We look forward to working with you during this time, and if you have any additional questions or concerns related to your diabetes diagnosis, please feel free to give us a call. Thank you.
So how to give insulin using an insulin pen. First, we want to gather our supplies. You want to have your pen needles, some alcohol wipes or some hand sanitizer, and a sharps container or disposable container. So we're going to start by washing your hands with soap and water, and if you don't have that available, you can use hand sanitizer. The most important thing with hand sanitizer is you want to make sure you rub it in and keep rubbing until it's dry. So once it's all dry, we want you to go ahead and remove the pen cap. And you want to save that, so just put it aside. If you're using a cloudy insulin, you're going to need to rub your hands together and mix the cloudy. But we're using a clear insulin here, so we're going to skip that step. We're going to take our alcohol wipe, and we just want to wipe the rubber membrane off on the top of the pen. Then we're going to pick up our pen needle, and we're going to take the tab off the pen needle, and it exposes the needle. We're going to stick it, push it right onto your pen, and you're going to turn it clockwise until it tightens on. Once you do that, take off the actual outer cap, and we're going to save that for later. And we're going to take off the inner cap. You want to make sure you don't forget the inner cap. Take that off, and we're going to throw that away because we don't need to save that. So when you look at your pen, you want to make sure you can see the insulin that you're using. There's a little window for the dose indicator. There's a little line here and here to indicate what dose you're using. So first thing we want to do, we want to make sure to do a safety check. So what you'll do is you'll turn the dose indicator to 2, hold it straight up, push the button down. You'll either see a stream of insulin or you could just see little droplets. That's letting us know that there's no air in the system. So once we do that, it goes back to 0. And so what we're going to do is turn the indicator to our prescribed dose. So just to show you, if our prescribed dose is 6 units, we can see, or say 5 units, we can see the 4, and then below the 4 there's just a line, it's no number, and then below that is the number 6. So we know 5 is between the 4 and the 6. So we can see how that lines up there. That's all you do, and you're ready to give yourself your injection. So I want to show you the best place to inject insulin is in the abdomen. So the abdomen is starting from your ribs to your hips, and it's as lateral as you can reach comfortably. We want to use the belly button as a guide and stay 2 inches or 2 finger widths away on all sides of the belly button and go on the outside of that. So we're going to pretend this is my abdomen. We're going to hold the pen like a dart, or maybe like you're writing. We're going to hold it here, and we want to go straight in at a 90-degree angle, push it in as far as it'll go. Then you could either use your other hand to push the button, or you could use this hand, the same hand, to push. You want to hold that button slowly until it can't go any farther, and then slowly count to 6. If you remove it too soon, you'll not sure you'll get the full dose. So 1, 2, 3, 4, 5, 6. Remove it, and that's all there is to it. Then we're going to take our cap, the outer cap that we removed, put it back on, and now you're going to turn it counterclockwise to remove it. And you'll see that The needle stays in the cap, and then you want to dispose of it in a sharps container. If you don't have a disposal container, you could use a puncture-proof container, such as a coffee can. You could use a empty prescription bottle, an empty laundry detergent bottle. We just want to make sure it has a cap that can be tightly sealed so that nobody gets injured. Then you want to take your protective cap and place it back on your pen. And that's for safety. That's because we want to protect the insulin from the light. That's all there is to using an insulin pen. Thank you.